Hello, everyone. I'm Michael Oldham. I'm the CEO for Portsys. Today, it's my pleasure to be able to introduce Ali Chandler from Milton Keynes University Hospital, who's going to talk about how they've been able to improve patient care through the use of technology. So I'm going to turn it over to you, Ali. Let's get right to the presentation.
Thank you very much. So yeah, I've been working for Milton Keynes University Hospital now for a few years. I've got around 20 years, just over, experience within the NHS. So been around a long time, seen a lot of stuff coming and going. And one of the things that we've kind of embarked on over time is the need to get to systems and data and do that in a secure way. And when I came to this organisation, we didn't really have a good way of securing access to systems for various scenarios. We looked out to the marketplace and evaluated a number of different solutions, and we settled upon the Portsys TAC solution to meet this need. And that need took a number of guises. So we have a number of scenarios that we need to support remote users. Obviously, at the moment, with a pandemic, that's come to the forefront of most IT departments across the globe, I'm sure. And the fact we already had this in place was a huge benefit to us. But at the time, the types of things that we were trying to solve was access to things like our EPR for patient data and various other imaging systems and so on that we have for patient care around the organisation. And the vast majority of that was for not just for MKUH employees, but for other healthcare providers that we work with. And that ranges from people in mental health through to social workers who work for the council. We also have some other support services such as Age Concern UK, and those guys we've been able to give access to our data and our systems in a safe, secure way that's been very easy to deploy. And one of the key things for us was to not have to issue out hardware to users that we don't necessarily employ and have to manage devices that wouldn't necessarily be on site or provide the best experience for users. I'm sure most people are now familiar with the concept of carrying two mobile phones around, and that in itself can be a problem for some people, let alone having to carry multiple laptops and what have you. So for us, it was about seeing what was in place and trying to be able to give access to our systems in a way that was easy for other organisations' IT departments, but that users can use the same device that they've always used. And that could be a device that's issued corporately by the organisation they work for, or it could be their own personal device. We're kind of agnostic to the device they use. And that was one of the key things about TAC that we liked. And so for those people, we were able to give them access via a web browser to a variety of things. Some of those applications are fairly simple web apps that we have hosted on-prem, and people can just log in to the portal, get to those websites. There's also other things we use that for. So we have things like remote desktop. So using standard Windows remote desktop, there's a number of apps that can't run in a browser. And so we reference through to those and connect users to those. And you can do some nice things there with things like single sign-on. So you can sign them straight into the remote desktop session. You can support multiple screens. You can set resolutions and that sort of thing. You can pass through sound and USB devices and all of the kind of usual stuff that we kind of expect now from RDP. So works very nicely for that. One of the other big use cases for us is that our EPR is hosted on Citrix. And we've found that we're able to publish out that Citrix app as well, which is one of the biggest apps that's used particularly by other healthcare providers in our area. And that works very well, very seamless. Essentially, it bypasses having to have some of the Citrix solutions that I know exist to publish that out to the internet. And we can have a single portal for the Citrix-based stuff, as well as all the other things that we have. And it makes it quite a nice and easy solution. We also have got that working with NHS smart cards. So if our remote user is on an NHS network, so HSCN at the moment, they can put their smart card in and fire up our EPR, and that just passes through as if they were sat at one of our own computers, as if they were one of our own users. And that for us has been a huge benefit in breaking down some of those barriers that do exist between organisations that have been historically very hard to overcome in terms of sharing data. I'm sure the day will come when all systems talk to all systems, but for now and for the coming years, this is a very good way to achieve that by giving people access to your own systems via their own device, and you kind of manage some of the things there. So one of the key things about connecting in is that you can do things like posture checking of the device, so you can set policies and rules around what apps you're going to give access to based on a number of criteria, and you can have this as open or as constrained as you like. You can do settings portal-wide, or you can do them based on just a given application. So for example, you could say you can log into our portal from anywhere in the world, but if you click on the PACS icon, if you're in a certain country, you can't get access to that. So that's a fairly simple, high-level thing that you might want to do. We do maintain a list of blocked countries, so we're able to put those in there and align that with some of our other cloud services, which is quite nice. You can also do things like checking if the machine has an up-to-date antivirus software on there. And if it doesn't, you can advise the person that they can't get this app because they don't have that up-to-date antivirus. And there's a whole bunch of other things you can do along that line. And that makes it quite powerful, and it goes a long way to solving some of the concerns of governance colleagues and IT security colleagues. Because you can do some of that checking. It's not just an open platform. So and you can see things like what machine operating system they're running, things such as browser versions, whether they're using Chrome or Edge or any of the others, and again make decisions on that. That can also be quite handy. On the odd times that there may need to be troubleshooting, you can kind of do that as well from the monitor. So it does give you a full session monitor as well, which is quite nice. You can see if people are logged in. So when they say they can't connect, you can actually see if they're even trying and if they're in the list, or if they're on a completely different website that's completely the wrong thing, which does happen from time to time. But yeah, it's overall very simple, very straightforward to use. I think also one of the other key benefits for us was that we found a number of suppliers who need to access systems remotely for support weren't on or aren't on HSCM, and therefore trying to give those guys access via a method that we can control is quite difficult. There are obviously other solutions that sometimes third parties like to use, but they may not always be compliant with what you want to do with your security, and sometimes you can lose visibility of what's happening with those. So not to talk them down necessarily, but sometimes they're not right. And certainly for us, we didn't kind of want to let that go. So we do have a use case here where we have a number of support companies and suppliers who have access to their server. In some cases, it can be a piece of medical equipment that they can, again, go to a website. And that can be as simple as they open up an RDP session and then use a tool to connect to their internal systems and servers and hardware. And again, it works very well. There's one we have that has a web interface for management on the device they manage, so they can quite simply get to that. And again, that's from their own devices. They don't have to be here. They can be anywhere in the world other than the blocked country list, and they can get access to that stuff in a way that we can control. And if we decide for whatever reason that an individual or person or company can't have access, we can just cut that off ourselves. And having that ability to do that in a simple, easy way is very useful. On the console itself, very straightforward to create apps. It's all kind of GUI based. There's no command line. It's simple to change things like certificates and all of those kind of management things. Anyone in the infrastructure team would be able to pick this up within a day or two and be able to create apps and give access to things. Another one of the key things for us was around the kind of day-to-day management of this. We're a busy IT department, as I'm sure most are, in a very busy hospital. We don't want to tie up people having to keep going into another system in order to give access to things. So the way that we've done this, we followed kind of an RBAC model in many ways, and we managed the entire thing from Active Directory. So once an app is created within TAC, we create typically a security group in AD for that, and then it's a case of literally just dropping users into that AD group, and the next time they log into the portal, they'll see the icons for those particular apps. And that's meant for us that can all be managed by our IT service desk. So with the exception of creating or removing apps, no other teams within IT get involved in provisioning users and provisioning apps within this. And for us, again, a huge benefit there, very quick, very easy. As far as the service desk go, they're used to putting people in and out of groups. So actually their job hasn't changed in any way in order for them to grant access to systems and apps, which is really quite powerful. And we've built on that a little bit. So one of the things we've done is create organizational groups within AD, and then that grants access to a whole number of applications. And you can be as granular or as open as you like here. So if you're working for a particular organisation, such as mental health services, we just drop you into that one group and you get access to the 5 or 6 apps that we've approved for use and that you need to do your job, and that aid in the care of the patients you're looking after. So that gives you access to look at our entire patient record, both the modern EPR that we have, as well as our legacy. We scanned in all of our legacy paper records, so you can view all of that information from here. You can view pathology results, imaging results, actual imaging as well. So our PACS system is available through this. You can view reports and all of the images for all PACS specialties, which is a very, very powerful tool. And you can use that yourselves. For MKUH staff, again, we're using this predominantly for end users who want to use apps from home, from their own devices. It's taken away some of the burden of IT of having to provide laptops and so on. And also, most people now have a device of some description within their home that they can use. Laptop sales are increasing and increasing. And surpassed desktops some time ago. So a lot of people at home have those, iPads, Macs, all of those things. You're able to do the same posture checking across all of those platforms and apply policies and rules where you see fit. And yeah, huge benefits there and made it a lot easier. And last but no means least, in terms of a use case, one of them was for IT support. So we run a number of on-call services. For the IT department, we have a couple of teams on call out of hours, and that's another way we can get in to provide support. And that can be something as simple as just connect to AD to reset a password, right through to remoting onto end users' machines, troubleshooting, and all of the normal stuff that IT people do. And at the moment, obviously, a large amount of those are working from home. So we're doing switch configuration, firewall configuration, and all of the stuff that we would normally sit at desks and do. We can sit at home and do those, use all of those same tools through the same platform that our end users and our support companies and our third-party healthcare providers are using. And it's one simple solution. In terms of the infrastructure for it, relatively straightforward. The solution is based on Windows Server. The latest version of that is supported on Server 2019, but I believe there's backward support for 2016 as well. We run that as VM, supported on all of the main hypervisors. You can have multiple servers if you want, so you can have resilient clusters. So if you're doing patching for the actual portal itself or for Windows, or you have outages, you can kind of mitigate against some of that risk by having multiple servers within clusters. And then we present that out to the internet via a DNS name linked to an IP address. You put a SSL certificate on there, and we open one port from outbound, which is port 443, and you don't need any other ports open for anything else, including all of the Citrix kind of redirection and all of the RDS, all gets proxied through port 443, which, again, firewall rules look nice and tidy. One single rule always looks good for the security guys when it's simple and straightforward, and you can write on your governance paper that it's just one single port that's open. So again, very simple, very, any IT department running Windows servers and hypervisors, it's just another one of those to have, and it, just slots right in and works off the bat. very easy to implement. I think our total implementation from start to finish was, I think, less than 2 days, and that included all of the network config and firewalls as well. So it really is straightforward to put in, and you can have something working. I would say these days, probably within a day, you could have access to applications. So straightforward, not loads of complexity, but at the same time, it offers a high level of security. And one of the other features that we're using is something called the safe login. And what that is very similar to multi-factor authentication. One of the challenges for MFA for many organizations, not least us, is that not all end users have a mobile device that they can use that's certainly not corporate owned. And people are often reluctant to use personal devices to receive text messages and those types of things. So with this, essentially, it's a soft token. This is fully integrated within the solution. It doesn't cost any more money. It just comes out of box. And that's another thing that we're using to provide an additional layer of security. It's not full MFA by any stretch, but in terms of our need, it went far enough to give access with additional layers. You can layer on traditional MFA if you want, so you can have the text messaging service if you need that, and I believe there's now integration as well into things like authenticator apps, which are quite nice, and people are getting more familiar with those as the cloud is evolving. So lots of options there, lots and lots of security, and that's built into the heart of the product. And I have to say we're very, very happy with it, and it's been a huge benefit for us and for our users, and not least people like me in IT who need to log in at 2 in the morning to reset a password or something like that. When we have a locum turn up, we use it to create those accounts and that sort of thing. So huge benefit to both the IT side and the support side of the business. But ultimately, we're here for our patients, and we feel that this solution goes a long way to help with that, particularly with the interaction of our third-party healthcare providers.
Thanks, Ali. That's great. So just very, very quickly, what total access control does is it allows an organization to reduce complexity. I think that's one of the really big things, and you can hear that from what Ali was saying, is the ease of deployment, the ability to reduce the complexity that we have overall. I think those are very important features that we have within total access control. It also, from a security perspective, dramatically improves the security of an organization. There are lots of options, lots of ways that can be used. You've heard a number of them from a real practical example that Milton Keynes is using, and I think it's a great example of some of the ways that we use total access control. There's a lot more detail to it, but we don't have enough time in this presentation to go through everything. But one of the important questions that I'd like to ask Ali is, if an organization is looking to implement this type of solution, what should they do? How should they look at being able to go to their executive team to be able to put a solution like this in place?
Sure. So I think from my point of view, talking about securities is sometimes a problem. Most high-level execs and high-level managers don't really get security. They just want to know, is it secure? And really they're after a yes. So for me, if you're starting to write business cases, trying to make use cases for this type of technology, focus on words like mobility. And remember that mobility, I think people often get that confused, and I've said this many times. People think of mobility and remote access as when you're not at the campus. And I think that's something that view needs to change a little bit. And I think, again, we use TAC. Probably one of the biggest cases is actually TAC is used is on-prem. We have a lot of those third parties, they just connect to a wireless network, whether that be our own public Wi-Fi or tethered to a phone or whatever it is, and they're using their own device. They can't join our corporate network because they're not our devices, but they're on-prem using those things. So be careful in the wording of things like mobility and remote access. Bear in mind that stuff is also all about being on-prem and having access to those things from your own devices. So for me, it's about selling the patient care benefit as well. You need to make sure that you can demonstrate that other healthcare providers can get access to systems in safe and secure ways, But the key focus there is patient care. Those are the words that people are looking out for. Get access easily, quickly to things like imaging, results, letters. Those things are what people need to treat patients today.
Great. Thanks very much, Ali. I think that's great words of wisdom.
Thank you.